Okay, let's unpack this. We're diving into a stack of sources today, tackling a subject that is, well, both challenging and critically important.
Absolutely. We're talking about how communities and individuals prepare for and respond to active shooter and hostile events. It's heady stuff.
It really is. But
Yeah.
understanding it is vital. And our sources today give us a really broad view. We've got a detailed technical standard, NFPA 3000, developed by experts.
Right, a big one. And then we also have research summaries on mass shootings, some recent local news from right here in Utah.
Yeah, which really brings it home. Plus, a newsletter from the Utah EMS Bureau, giving that specific local angle.
That mixed national standards, research, local context, it paints a pretty comprehensive picture, doesn't it?
It does. And that's our mission for this deep dive, to sift through all this, pull out the key insights for you, the listener. We want to extract the core ideas, from response protocols to local perspectives, the research findings.
Basically help you grasp the whole multi-layered approach to dealing with these incidents, a shortcut to getting informed on a complex issue.
Exactly. And, here's where it gets really interesting. These sources, they touch on everything. I mean, first responder gear, tactics.
But also community training, the psychological aftermath. It's a much wider scope than just the event itself.
Okay, so let's start with that foundation piece, the NFPA 3000 standard. It kind of sets the stage, gives us a common language. What exactly is an active shooter hostile event, or ASHER, according to this?
Right, the standard defines it pretty broadly. It's not just firearms, the active shooter part. It also includes active assailants, meaning individuals using other explosives, vehicles, knives, edged weapons, basically, anything used to harm people in a populated area. ASHER is the big umbrella term.
Got it. And this standard, NFPA 3000, it wasn't just whipped up overnight, was it? Reading the background, it sounds like a major undertaking.
Oh, definitely. It involved a 46-member technical committee, a huge group.
And diverse too, right? Law enforcement, fire, EMS, federal agencies.
Healthcare, private security, universities, local government, a real cross-section. And they actually petitioned to get this standard out quickly back in 2017.
Why the rush? What prompted that expedited release?
Well, the sources are clear on this. They pointed to the significant increase in, the frequency and the severity of these kinds of events happening since around 1999.
So a growing problem needed a standardized response.
Exactly. Before NFPA 3000, there wasn't a single accredited consensus standard for this. Different agencies were kind of doing their own thing, figuring it out as they went. This was meant to provide that unified framework.
And what's really fascinating, a key takeaway for me, is this emphasis on a community-based approach. It's not just for the pros.
Precisely. That's a core principle. The standard really pushes the idea that preparedness, mitigation, response, and recovery, it all requires partnerships.
So not just police and fire figuring it out.
No. It explicitly includes public and private groups, emergency management, healthcare, and crucially, the public itself. Everyone has a part to play.
Okay, so what does that look like in practice? What are the required elements for an ASHER program according to the standard? It gets pretty detailed.
It does. It lays out the essential pieces. First up is risk assessment. You need to identify potential targets.
Like schools, hospitals.
Right. Religious facilities, large events.
Yeah.
And you have to consider factors like, how easy is access? What's the public profile? Are there known threats?
Makes sense. What else?
Then comes planning and coordination. That means setting up things like unified command so everyone works together smoothly on scene, and having clear standard operating procedures, or SOPs.
To avoid confusion when things are chaotic.
Absolutely critical. Then there's resource management personnel, equipment, funding, mandatory training, communication plans, rules for personal protective equipment, PPE, and importantly, recovery procedures for after the event. It really covers the whole life cycle.
Okay, let's shift gears a bit from the big picture framework to the front lines. The tactical response, the people involved. The sources talk about specific roles, starting with the AHJs. Authorities having jurisdiction.
Right, the AHJs. Think of them as the local orchestrators. They're responsible for developing the overall program for their area or organization, doing those risk assessments we mentioned, planning, making sure the resources are actually there.
And then you got the boots on the ground, the fire, EMS, law enforcement, critical roles, distinct but increasingly integrated, it sounds like.
Very much so. Historically, fire and EMS would often stage quite far back, waiting for law enforcement to declare a scene completely secure.
Which could take a long time.
A very long time. And with active bleeding, time is everything. So the standard and the tactics discussed reflect a major shift. Fire and EMS are now expected to protect themselves, obviously call for backup, but also be prepared to move into less secure areas carefully to provide that rapid medical help.
And that brings us to this key concept mentioned a lot.
Yeah.
The Rescue Task Force, or RTF.
Yes, the RTF. This is a really fundamental change in operations. It's designed specifically to get medical aid to victims much, much faster.
How does it work?
It basically pairs up law enforcement officers who provide security, force protection with fire and EMS personnel. This team then moves into what's called a warm zone.
A warm zone, meaning?
An area where the immediate active threat might be contained or neutralized, but it's not yet totally 100% clear and safe. There's still risk.
So they go in before it's all clear.
Under specific conditions and with LE protection, yes. They go in to do threat-based care, stop the bleeding, basic life support triage victims, and get them out quickly to more definitive care. It's a calculated risk, definitely.
But the alternative is potentially waiting too long.
Exactly. Waiting potentially hours for a scene to be fully secured while victims are critically injured. The RTF aims to drastically shorten that time to treatment window.
Wow. That really underscores the danger these responders face, especially going to those warm zones. Which brings up personal protection. What about body armor?
Good question. And the sources, especially NFPA 3000, are very specific here. It mandates the use of personal protective equipment, PPE, specifically ballistic protective equipment, or BPE.
Mandates, not just recommends.
Mandates. The standard uses the word shall. It requires that body armor provided for personnel going into areas with ballistic risks shall be, at a minimum, a level 3A ballistic vest.
And it mentions a specific standard, too, NIJ Standard 0101.06. What does that signify?
NIJ is the National Institute of Justice. They set the performance standards. Level 3A is rated to stop common handgun rounds, up to things like a .44 Magnum, even from longer barrels. And the NIJ certified part means it's been rigorously tested to meet that standard.
So it's not just any vest, it has to meet that tested level of protection.
Precisely. The standard says it must be NIJ certified. It reflects the reality that these responders, fire and EMS included, might face threats previously only associated with law enforcement. Equipping them appropriately is seen as non-negotiable.
Okay, so the professional response is clearly defined with standard tactics equipment. But the sources also keep coming back to the public's role. It's not just up to the professionals.
Absolutely not. That community-based approach we talked about, this is where it really hits home. The NFPA standard and other sources too, they explicitly encourage the public to get prepared.
Prepared how?
To get trained, participate in drills and exercises, partner up with local emergency management. The idea is that you, as a member of the public, are actually part of this whole preparedness ecosystem.
And public education is a big piece of that. What kind of info are they pushing out?
Yeah, education programs, often based on those local risk assessments, aim to tell people about the different hazards, active shooters, vehicles, explosives, whatever the local risks are and what you can do. The most well-known strategy is probably run, hide, fight.
Giving people options for immediate action.
Simple, layered options, exactly. Run if you can, hide if you can't. Fight as a last resort. And beyond just survival tactics, there's a huge push for immediate medical help by the public.
You mean like first aid?
Specifically, basic bleeding control. The Stop the Bleed campaign comes up frequently. The idea is that bystanders can save lives by stopping severe bleeding before professional help even gets there. Training people and having bleeding control kits available in public places is a big part of it.
Okay, so that covers the national standards, the general principles. No, let's bring it local. The sources connect this directly to Utah.
They do. And unfortunately, it's through recent tragic events. Our sources include a Gephardt Daily report from just June 16th, 2025, about a terrible shooting at a carnival in West Valley City. Multiple fatalities, including an infant.
Just awful.
And an SLC.gov press release from June 14th mentions a shooting during a downtown demonstration. These aren't abstract threats. They're happening right here, impacting our communities.
And then we had that Utah EMSC newsletter from March 2025. It adds another layer, doesn't it? Broadens the conversation.
It really does. It brings in some critical data points that shift the perspective.
Yeah.
It highlights firearm injuries as the leading cause of death for children nationally. And here in Utah, specifically, the leading cause of death by suicide.
Wow, the leading cause by suicide in Utah. That really reframes it, as the newsletter says, as a public health crisis.
It does, and it points out something important. While mass shootings get massive media attention, they actually make up only about 1% of overall gun violence.
So the bigger picture is much broader.
Much broader. Suicide, according to the newsletter, accounts for nearly 6 out of every 10 gun deaths. That's a huge proportion.
And the newsletter connects this to local data about gun ownership.
Yes, it shares some pretty sobering Utah statistics.
Right.
Apparently, 48% of households here own guns. And of those gun-owning households, a high percentage report having guns that are loaded 62% and unlocked 58% in the home.
58% unlocked. That seems high.
It's striking data. And based on that, the newsletter makes a very direct point. It says, quote, addressing the firearm epidemic isn't about changing that culture. The most effective immediate solution is improving safe storage practices.
So focusing on a practical step based on that local data about how guns are stored at home.
Exactly. It's presented as a direct, actionable response to the specific risks highlighted by the data, particularly the suicide numbers and the unlocked guns.
Does it mention any specific initiatives?
It does mention one called Agree to Agree. And this initiative, according to the newsletter, explicitly focuses on firearm injury prevention. It states clearly, this is not about gun control, this is about firearm injury prevention.
Try and find common ground.
Right, suggesting interventions like safe storage, maybe temporary removal of access for someone in crisis, like a mental health crisis, and voluntary risk protection laws. The local perspective here in this newsletter really zeroes in hard on safe storage as a key immediate step, given Utah's specific statistics.
That local data adds a really powerful dimension. Let's pull back a bit now and look at the broader research landscape, drawing from sources like Wikipedia summaries, academic reviews. They add more nuance, right?
They definitely do. And one of the first things the research highlights is actually defining mass shooting. It sounds simple, but there's no single universally agreed upon definition.
Really? Why not?
Well, different groups use different thresholds for the number of victims, different criteria about the location, whether the motive matters. So one study might count an event that another doesn't. It makes comparing data tricky.
So even just tracking the problem consistently is a challenge. What about figuring out what works to prevent them? The sources mention research on policies like the federal assault weapons ban, the FAWB.
Yeah, and the research cited there is often described as inconclusive or showing pretty limited evidence that the ban significantly reduced the frequency or the deadliness of mass shootings.
Why is it so hard to study?
Well, the sources explain it's partly because these events, thankfully, are still relatively rare compared to other forms of violence. And they're highly variable, different weapons, locations, motives. This makes robust statistical analysis really difficult. It's much harder than, say, studying the impact of seatbelt laws on car crash deaths, where you have vast amounts of data.
Okay, so the research doesn't offer easy answers on policy, based on these sources anyway.
Yeah.
What about the individuals? Does research point to a typical profile for mass shooters?
Not a single neat profile, no. But studies do suggest some common factors often crop up. Premeditation is very common. Suicidal ideation is also frequently reported. Some researchers even frame these acts, tragically, as a kind of angry suicide.
And there was something mentioned about leakage.
Yes, leakage. That's a really significant concept. It means the perpetrator leaks or somehow signals their plans beforehand, sometimes subtly, sometimes more openly.
To friends? Online, maybe?
Could be anywhere. And the research finds this happens quite often. Critically, leakage has also been linked to the perpetrator having had prior counseling and showing signs of suicidality.
Which sounds like, potentially, an opportunity.
Exactly. The research suggests this leakage might not just be boasting. It could be interpreted as a kind of cry for help, a signal that, if someone recognizes it and acts on it, could be a crucial moment for mental health intervention before violence happens. Other factors like unemployment, social isolation also come up in research, but they're common in many situations.
And finally, the psychological impact. It must be immense for survivors, for the communities directly hit.
Oh, unquestionably. The sources confirm significant adverse psychological effects for those directly involved. But the research also presents a finding that might seem counterintuitive about the rest of us, the indirectly exposed population, the broader public.
What's that?
It suggests that the emotional and political impact on people not directly involved tends to be, well, limited and often short-term. The shock and outrage might fade relatively quickly for the wider population.
And the sources connect that idea to policy debates.
Some authors cited in the reviews hypothesized that this limited, sort of fleeting impact on the broader public might partially explain why these horrific events haven't always translated into sustained, major national policy changes compared to maybe other public safety issues. It's a provocative thought raised by the research.
Okay, so after diving through all this, the standards, the local realities, the research, what does it all mean for you, the listener? How do we pull this together?
Well, I think this deep dive really shows that tackling active shooter and hostile events isn't simple. It's a complex, multi-pronged effort. It operates on many levels at once.
Right. On one level, you have the need for comprehensive standards like NFPA 3000 that guides the professional response, defining roles, requiring specific tactics like the RTF, mandating gear like those certified ballistic vests for responders going into harm's way. That's one vital layer.
And then there's the need to understand the bigger picture of firearm injury as a public health issue, looking beyond just mass shootings to things like suicide. And the risks tied to unsafe storage in homes like that Utah data really brought into focus.
And the sources hammer home the importance of public preparedness, too. Knowing what to do, run, hide, fight, being trained in things like stop the bleed, that's critical.
And they point towards immediate, practical actions people can take, especially highlighted by that local perspective. That focus in the Utah newsletter on safe storage as a key way to prevent injury, framing it specifically around safety and harm reduction.
And finally, the research serves as a reality check, doesn't it? Reminding us about the complexities, the difficulties in defining and studying these events, the nuances around perpetrator profiles, those potential intervention points like leakage, and the different ways these events impact people. There's no single magic bullet.
No, definitely not. It takes effort on many fronts. We've certainly unpacked a lot today: standards, local specifics, research findings.
And this comprehensive view hopefully highlights that addressing these incredibly difficult events involves that coordinated professional response, yes, but also community readiness, individual actions like safe storage, and a deeper understanding of all the contributing factors and the research challenges.
So here's a final thought for you to chew on. Given everything we've looked at, the different definitions, the challenges in proving what policies work, the various focus areas from tactical gear to public health and safe storage, what does all this suggest might be the single most impactful area for you as an individual in your own community to focus your energy on to contribute to safety?
Something to mull over as you go about your day.